Hello, everyone. My name is Damian Gallagher. I'm coming to you live from Emerald's 31st Annual Groundhog Day Investment Forum. I'm lucky enough to be joined right now by Dr. Nishit Trivedi. Nishit is a director on our life sciences research team. He's been with Emerald for over 18 years now, focusing the majority of his research efforts on the medical device industry within the healthcare sector. So thank you so much for joining me, Nizzy, and taking a couple minutes out of the day to
Thank
talk.
you. Sure.
Just want to expand a little bit more, talk about the world of diagnostics. What are you seeing out there that's exciting and new happening in the space of diagnostics?
Some tremendous changes and tremendous innovation that's kind of happening in diagnostics. And if I just bring up two areas for discussion today, there's oncology, where there's significant innovation happening in how do you identify cancer early, as well as how do you identify cancer recurrence. And so liquid biopsy, there is more than a dozen companies that are kind of working in the world of liquid biopsy, and they are kind of both at the front end as well as in figuring out and detecting cancer recurrence. In the world of neurology, a lot of exciting things happening because we have ultra-sensitive detection technologies that can replace the traditional methodologies. For example, in Alzheimer's, which is a big burden to the society, which is affecting millions of people worldwide. And if we look at the disease, it's going to affect 1 in 9 Americans. The current gold standard is doing a PET scan to diagnose Alzheimer's. But now we have newer technologies where non-invasively you can detect Alzheimer's by blood-based biomarkers. That's meaningful. That's a game changer, according to us. So some of those new biomarkers are still being evaluated. There's been some interesting research that's come out just last week in the journal JAMA that finds p-tau 217, for example, is very exciting in the world of Alzheimer's. So there are these newer technologies that can give you the same information that you would get that can give you the same information in a blood test that you would find out in a CSF test. So less invasive, easier, more cost-effective, saves the healthcare system more dollars, and helps you identify patients earlier. Thanks.
All right, great. Well, it's great to know that a lot of developments happening to better just humankind in general. So
exciting times.
Yeah, just want to talk about AI. I feel like AI was a huge topic in 2023, and it still continues to be a big one today. What's exciting about AI and how AI is going to be used within healthcare and on the med device side that you're watching?
AI today is kind of being used in almost every sector of healthcare. As an example, when it comes to imaging, a lot of AI is used in imaging. Just let's take the example of mammograms. Traditionally, the radiologist is looking at hundreds of thousands of mammograms, and using AI that's being trained on millions of mammograms, AIs have the power to complement and enhance the productivity of the radiologist. So sometimes you can kind of screen 1,000 mammograms, and then the mammograms can, and the AI can label specific areas that need more attention. So this is about enhancing the productivity of the radiologist and having more cancers identified earlier, which leads to better prognosis. So I think AI kind of is being used in diagnostics. AI is being used in spatial genomics. AI is being used in drug discovery and drug development. So there are just tremendous uses of AI. And the interesting thing was, I was at the JP Morgan conference this year in January, and the most packed presentation was NVIDIA, because everybody wanted to know what NVIDIA is doing in healthcare. So this was the JP Morgan Healthcare Conference, but the most packed presentation I found is NVIDIA, where they kind of highlighted some of the newer technologies that they're working with to incorporate AI and use the power of AI to enhance both the, in many areas of healthcare.
Sure. Well, thank you. Well, I do want to let you go on that note. I know you got to get back to the conference, so thank you so much for joining.
Thank you.
And thanks for all that you do for the team, and appreciate all your help.
Great.
Thanks.
Thank you so much.